Welcome to today's lecturette. I'm Dr. Leslie Jones, and today we're going to be discussing the use of big data and its role in informing public policy and professional practice. In our last lecturette, we discussed the importance of research and the types and approaches to research that provide a range of different forms of information for the sector. Today, we're going to take a much closer look at some of that information in the shape of big data that is gathered across our country and the ways in which it is used in the early childhood and schooling sectors. Big data, as the name suggests, is data that is gathered from very large samples and sometimes even whole of population perspectives. The most relevant data sets for our discussion today include the Australian Early Development Census, or the AECD data, the Early Childhood Workforce Census, the National Quality Standards data, and the overarching Population and Housing Census data. Big data sets are collected commonly in two basic ways: accumulative or point in time. Census-style data collection is data that is collected all at the same, so point in time, and can capture data from across whole populations or whole sectors. Accumulative data collection is data that is collected in an ongoing manner, but is reported on at regular intervals, such as in annual reports and such. Each collection style produces in-depth quantitative data for analysis and interpretation. As well as data simply reporting volumes of counts and frequencies against categories and criteria, analysis of big data often contains something called trend analysis. Trend analysis compares the same big data sets at earlier collection times. This type of analysis helps trace performance for improvement or decline of whatever it is that is being surveyed or being investigated. This is really important information, but it's only part of the story. It's what the sector, governments, communities, and to some extent individual professionals do with this information that is the critical outcome of using big data collections. As we discussed in our earlier lecturette, understanding the why of data results requires a qualitative lens and a working theory to be generated that will inform planning and tactical responses. This is the work of those analysing the data and proposing actions, including the development of public policy responses to address any concerns that may be represented in the data. Census data, including the AEDC and General Population and Housing Census and the Early Childhood National Workforce Census, is data that is collected at a single point in time. On a given date, the data from all across the country or sector is collected for each relevant census at the same time. As you can imagine, the volume of data collected in this way is huge, and sorting and analysing the data that is generated takes a significant amount of time, in some cases more than a year. So census data is carried out relatively infrequently. For example, the Population and Housing Census is only conducted every 5 years as it collates the data generated to identify the trends across our entire population of 26 million people. The AEDC data has been collected 4 times since 2009, and in fact, the latest data has just been released, which we're going to talk about shortly. And the Early Childhood National Workforce Census has been conducted 3 times in the last decade. People who use big data look to examine the trends that may be occurring or to inform their thinking about future projections for social infrastructure. For example, if the Population and Housing Census were to indicate that there was a significant population bubble in a region, and there are indications that there may be a large cohort of, for example, 5-year-olds in a given community, policymakers at state, federal and local areas and governments may begin to think years ahead of when the census data is actually collected, as they begin to plan for where they may need more schools or hospitals or emergency services. Without census data of this scale, accurately planning for the future community needs would be incredibly difficult to manage. Let's now turn to the AEDC census and the data that is collected. This census is a specific example of the big data generated through this type of census collection, and we can see a good example of how big data is becoming more and more integrated into strategic planning at many levels of government and community organisations. The latest 2018 AEDC data has now been released, and you can see here the snapshot of the results at a national level. During 2018, in excess of 96% of all children entering school across some 549 communities underwent standardised assessment of the 5 developmental domains as they began school. And the results are in. We now know that we have 1 in 5 children and 2 in 5 Aboriginal and Torres Strait Islander children beginning school developmentally vulnerable in 1 or more domains. This result in this census continues to improve marginally from previous data collections, but it really is a pretty sobering thought to think that we have this level of developmental vulnerability present in our local communities. Consider what impacts these results have on school and support infrastructure. And of course, it brings into sharp focus the work being undertaken within the family context, as well as the prior to school context, such as kindergarten, childcare, and other settings for the quality of service provision and early learning programs that children have access to. The federal government's objective for the AEDC is to provide evidence to support policymaking and planning and action for health, education and community support that can assist governments and communities to develop flexible approaches to policy and planning that eventually will address the evolving needs of children and families in their local communities into the future. There is also a growing use of data by centres and other community service providers, and even down to individual professionals working as practitioners, as a general guide to shape their thinking in terms of localised planning and strategies to improve child outcomes. A range of specifically designed community and centre-based programs have been developed in direct response to AEDC data being available over the last 10 years. Programs such as motor skill programs, social and emotional wellbeing programs, and language programs, to name but a few. However, it is important to remember that population-level data, such as the AEDC, is a generalised quantitative account and does not tell us why vulnerability is present at a population level. Nor does it tell us information about specific children or specific families. While the AEDC data can be drilled down to a community level, this is still a significantly large data set. Making assumptions and generalisations about community-level data should be done with great care. Professionals working with individual children must recognise that individual families and individual children can be very different from population data trends that would suggest. To overgeneralise how we perceive children and families based on big data such as the AEDC and population and housing census data can generate stereotypes and potential bias. Another important data set that is critical to the ECE sector is the NQS data, the National Quality Standards data. This data is collected throughout the year from across the sector as services undergo the rating and assessment processes. Data is collected of the service performance against the National Quality Standards and elements to produce an overall rating result. This data is aggregated, the elements, standards and overall ratings result by service type for the whole of sector each year. This data provides important information to government and service providers and the sector overall on the performance of the sector against the standards and elements. The snapshot report, just recently released, shows trend data since the inception of the NQS in 2012. It identifies a generalised improvement in quality as measured by the standards across the country over time. This data highlights a common trend for where standards are being met or not met, and volume counts for the numbers of services attaining different overall ratings. This data is also segmented by service type, so kindergarten, long daycare, family daycare, and other types of settings. Since its inception, the volume of services attaining a meeting or above rating have steadily improved. Some would suggest that this is to be expected as the sector and assessors grow more comfortable with the system and the processes of rating and assessment. The discourse on the ratings and assessment system has been at times quite robust and has come into sharp focus with the updates to the ways in which the exceeding rating is now obtained. 2018 saw the introduction of more stringent evident processes for the overall exceeding rating to be obtained. Not surprisingly, the percentage of exceeding ratings being given out to services has dropped dramatically. It will be really interesting to watch how this trend recovers over the coming years as the sector grows more accustomed to the new process. But again, brings into sharp focus the notion around how we define quality and how we assess it in our services in the early years. In one of our future lecturettes, we're going to be taking a much closer deep dive into quality in the ECE sector, and we will continue to discuss the NQS and the broader notions of what we mean by quality service provision. For service operators, the biggest strength of having access to trend data such as the NQS snapshot reports is that it can provide really useful information as to how other services in general are tracking, and in general, where there seems to be common pain points across the sector in terms of rating and assessments and elements and standards. This can assist individual service providers in focusing their efforts in areas that they may not have considered previously. Of course, this has to combine with their own individual self-assessment of their performance against the NQS and the development of the individual services quality improvement plan. The final big data set that I want to outline for you is the Early Childhood Education and Care National Workforce Census. This census is part of a range of Australian government initiatives designed to improve the quality of information used in developing and measuring early childhood policy, programs and impact. The census has been conducted every 3 years since 2010 and is a nationwide survey of early childhood education and care services, which collects information about service usage, children with additional needs, the volume of access to preschool and kindergarten programs, and staffing profile information, including qualifications and study profiles of centre-based services. For example, this census provides information to the sector on how many staff members across the sector have Certificate 3, diploma or degree qualifications, and also those who are studying towards a higher qualification. It also traces the average attendance patterns of children attending services and centres. Now, I can imagine some of you may be thinking, who cares really how many Certificate 3 people or diploma people or degree qualified teachers we have, as long as we're all meeting regulations? Or why would it be important to know the average attendance patterns of children by age group and service type? However, as we become more sophisticated in collecting information such as profile information and participation information, researchers are in a better place to see the connections and make hypotheses about causation. There is a growing trend across Australia and many other parts of the world to link big data together to get an even more detailed picture. And this linkage of the big data gives us a better clue into why things might be happening. By linking big data analysis, we are able to draw connections between one data set and another and draw inferences about the connections and causations of things that we are studying and looking at. As an example, could it be helpful, for instance, if we could link NQS rating data to AEDC data at a community level in the future? Could this show us if there is any causational relationships between the overall community average for NQS ratings and the AEDC results? Or could there be a link between the number of days children attend and the AEDC results? Is AEDC data better or worse in communities where attendance is more consistent and of a greater volume than in other communities? We can see a working example of how data linkage can actually be really helpful if we examine early childhood participation rates and NAPLAN results. So this participation rates is not looking at how often children come, but whether they attend an early learning program at all or not. And the data is really promising and shows evidence that children who attend 1 or more years of an early learning program do better in NAPLAN all the way through their primary schooling than those who do not. This is a sort of really encouraging data analysis that we can expect the more that we link data together in those big data sets. The collection and analysis of big data is a critical aspect of reviewing public policy for efficacy in achieving the policy objectives. The data can be used to confirm that the plan and objectives are on track or highlight that the strategic and tactical approaches may need refining or reshaping altogether if objectives are not being reached. Big data is used consistently as a barometer for the effectiveness of public policy. Consider the use of big data sets relevant to universal access funding that we've spoken about before. The participation rates of 4-year-old children in programs delivered by qualified teachers is of particular interest to current state and federal governments as they operationalise the universal access funds through a series of partnership agreements. These agreements have stringent participation targets that form part of the conditions for state governments receiving ongoing funding. Data collection helps trace the performance against those targets. For example, Queensland participation targets have been above 97% for 4-year-olds for some time now. When UA funding first came into effect, Queensland had a participation rate of just 27%. Collecting successive data about participation rates from 2009 onwards has been an important proof point for the state government that their public policy and their approach to using UA funding through, in particular, long daycare services is having the desired impact. That is, to significantly improve the participation rates in early learning programs by 4-year-olds in Queensland. Without the aggregation of big data, this would be really hard to validate. This highlights one of the most important practical or operational applications of big data, and in fact all data, and that is to assist in strategic and tactical planning to improve or correct performance and/or desired outcomes. As a working professional, you will come in contact with a range of data, both raw and synthesised into reports or articles. And it's important to understand the role data can play in assisting your thinking and planning about and for children and their families in your local communities. Building the skills to read, interpret, and critically consider big data is an essential skill for all early childhood professionals and educators to develop. Thank you for joining me for today's lecture, Ed, and I look forward to our next session where we will begin to focus on the relationships we have with families.